Hello, dear students. Welcome to the video lecture series on general methods for the treatment of poisoning for the syllabus designed by Swami Ramanand Tirth Marathwada University, Nanded for 4th year B Pharmacy at semester belonging to subject Clinical Pharmacy and Drug Interaction. Subject code is BPH87. Myself, Dr. J.P. Lavande, Associate Professor, Department of Pharmaceutics, Shulingeshwar College of Pharmacy, Almala, Taluka, Ausa, District, Latur. In general methods for the treatment of poisoning, we already saw introduction, signs and symptoms, and diagnosis related for the same. In these coming couple of slides, we will go through the testing for the poisoning if that will happen accidentally. So in most cases, laboratory testing provides limited help. Standard really available test to identify common drugs of abuse, often called toxic screens. These are qualitative and not quantitative. These tests may provide false positive or false negative results, and they check for only a limited number of substances. Also, the presence of a drug of abuse does not necessarily indicate that the drug caused the patient's symptoms or signs. Urine drug screening is used most often but has a limited value and usually detects classes of drugs or metabolites rather than specific drugs. For example, an opioid urine immunoassay test does not detect fentanyl or methadone but does react with very small amounts of morphine or codeine analogs. The test used to identify cocaine detects a metabolite rather than cocaine itself. For most substances, blood levels cannot be easily determined or do not help guide treatment. For a few substances, for example, acetaminophen, aspirin, carbon monoxide, digoxin, ethylene glycol, iron, lithium, methanol, phenobarbital, phenytoin, theophylline. Blood levels may help guide the treatment. Many authorities recommend measuring acetaminophen levels in all patients with mixed ingestions because acetaminophen ingestion is common, is often asymptomatic during the early stages and can cause serious delayed toxicity that can be prevented by an antidote. For some substances, other blood tests, for example, PT for warfarin overdosage, methemoglobin levels for certain substances help guide treatment. For patients who have altered consciousness or abnormal vital signs or who have ingested certain substances, tests should include serum electrolytes, BUN, blood urea nitrogen, creatinine, serum osmolality, glucose, coagulation studies, and ABGs. Other tests, for example, methemoglobin level, carbon monoxide level, brain CT, may be indicated for certain suspected poisons or in certain clinical situations. For certain poisoning, for example, poisoning due to iron, lead, arsenic, other metals, or to packets of cocaine or other illicit drugs ingested by so-called body packers, plain abdominal X-rays may show the presence and location of ingested substances. For poisonings with drugs that have cardiovascular effects or with an unknown substance, ECG and cardiac monitoring are indicated. If blood levels of a substance or symptoms of toxicity increases after initially decreasing or persist for an unusually long time, a bedswear, a sustained release preparation or re-exposure, that is repeated covert exposure to a recreationally used drugs, should be suspected.